Hello everyone, I'm Dr. Taskeen from Homeopathy Musing, and I'm so glad to welcome Dr. Mayuresh Mahajan sir. Sir is going to be treating pathological cases in homeopathy with HHF mind method, a session, one day session. And sir is here to answer certain interesting questions. So we can begin with today's session. Sir,
Okay.
you are going to be specifically talking about pathological cases, right? In this session, I am very
Yes.
curious to know that what is the correlation of pathological cases and the mind? When you talk about pathological cases, what importance that mind hold in treating or managing those cases?
Basically, homeopathy was regarded as a medicine for hair fall, corns, and cold and coryza, and increasing the immunity power and what so on. That was what when we started practice in 1997, 98. That was the era. But I want to tell every homeopath, you are a homeopath. You have a tool called homeopathy which has an efficacy to cure so many, you know, dreadful diseases, basically. So the main motto will be that homeopathy and a homeopath, both, if at all, they have that faith in homeopathy, homeopaths. If homeopaths have that faith in homeopathy, if they have that, confidence among themselves, that is what we in HHF, the only motto of HHF is installing confidence in all budding homeopaths and all the homeopaths who feel themselves, a bit low, a bit, can I do this? Ye mere, is this is not my cup of tea. This is not my case. It's not me. I cannot take this. This is not in HHF because we instill this confidence amongst every homeopath. And with respect to pathological cases, with respect to patients which who are admitted in the hospital, with respect to cases who are in, I would show you a case of coma if you want. I'll on the day how this beautiful one single dose can cure a case of coma, and what is the importance of the mind section of the repertoire, which was almost ignored. And that is what is the job of HHF, that we will single out every single rubric which is very common in day-to-day practice in treating pathological cases. What is the importance of emotions? How we land into a pathology? Why does a man fall sick? Man is made up of will and understanding, and if at all there is a conflict between the will and understanding, the cell starts, vibrating in a different way, in a different direction, just because of the conflict between the will and understanding. This whole body, the entire body comprises of trillions of cells, and they vibrate in a definite direction. And this vibration of the cells, they carry certain amount of energy, they carry certain amount of power, and they vibrate amongst themselves in harmony. And when there is a conflict between the will and understanding, the body starts, giving small, small signals that I'm not happy, in the form of pain, in the form of diseases, in the form of inflammation, in the form of, swelling, in the form of ulcer, in the form of small, small things. And then if they are not treated, and this will and understanding just goes on multiplying and multiplying, then body starts generating some force which acts against the vital force, which is called the disease. And that is this negative force against the vital force comes up with the conflict between the will and understanding. And this is where the man falls sick. Just if I just take an example, that I happen to be from a very urban area. I'm a girl and I got married in a very remote place. No, I listened to my father that yes, I will marry to this guy because yes, he's very nice, his family is good, everything is fine. And I'm a very ambitious girl and I have to go to a remote place where there is no scope of my, ambitions. But still, my will is telling me, कि यार, you should go somewhere else. What the hell are you doing in this place? But my understanding says, nee, nee, this is the desire of my parents to marry with this boy. So I have wholeheartedly being very much committed with my husband. So my will wants to go somewhere else, but my understanding says, no, you have to sit here and stay happy with this husband. Now, this constant conflict. One understanding is that I am a good wife. I will be a very good, committed wife. I will be a very, moral wife. I am dutiful. I am responsible. I need to follow whatever my father says. I need to follow whatever my husband says. This is one thought process which she's carrying. And at the other side, she wants to do something else. She wants to be a, an officer or a, IS officer or something else. But this conflict between the will and understanding, body will start getting affected. The negative force because of the will and the understanding, the will and the conflict is at one side, I want to be a very good wife, and the other side, I want to be a nice officer. Now, this conflict, this, if you call, you can see this conflict, the friction, the cells start getting damaging, and this damage goes into a state of disease. Then what happens? Then ovarian cyst, then ovarian tumor, chocolate cyst. And what is the contrast? I am not able to do what I want to do, and I should be a very good wife. Homeopathy is the only medicine which can resolve the conflict, where there will be a arrangement, there will be a harmony, there will be a balance, there will be an equilibrium between the will and understanding, and the patient gets resolved. Understand? There is a rubric actions are contrary to intentions. There is a rubric sensitive to moral impressions. There is a rubric element from domination. There is a rubric villain has been imprisoned. मैं तो जेल में आ गई यार. Now there are so many rubrics and are so beautiful rubrics. So I'll show you a case of road accident. The person was almost dead, and what is to be considered? अरे, he was just lying down. What was he doing on the bed in spite of semi-comatose state? What was he doing? Very interesting observation. We can give medicines. That I'll show to the delegates how a patient of coma was, so well. There are so many cases. So this is how.
So no, not necessarily a conversation should be there. You'll have to observe even in such patients.
Of course, sometimes what happens. See, what is the beauty of keen observation? Keen observation. What Hahnemann sir has said, what Kent sir has said. You have to read in between the lines. When I ask patient, who is the headache? The wife is sitting here and I ask her, who is your headache of life? She looks towards the husband and said, no one, no one, no one, no one. I could see that the husband is the headache of his wife, or his wife is the headache of her husband. So this observation, the questions, the will, the understanding, where everything has gone wrong, what is exactly deviated, where the vital force is deranged. That is the thing which you have to just focus upon. Just pick up the rubrics which you find which are really deranging the life of the person. Once you give that remedy, the rubrics, you select the rubrics which will, you know, balance the derangement of vital force. That is what we have to do. Then the vital force makes everything perfectly fine on its own.
Very well said, sir. So looking forward to this very interesting session with you, sir. Sir, in such cases where you told that a conversation is not required and you have to observe, there are certain chronic or certain acute cases, pathological cases such as kidney stone, where certain kind of questions need to be asked. What how will you explain the importance of these questions in such
Mostly when a
situations?
patient comes to you, I believe every homeopath will agree with this, that whenever a patient of kidney stone comes to you, most of the times, what happens is the patient comes to you, he takes a painkiller or he's been admitted one day before because of the intense acute pain. And when the patient takes the painkiller, the pain get resolved. After getting resolved, the pain is resolved, then he comes to the homeopath for permanent treatment. Most of the times, I have see, whatever happens in my clinic is something different, but mostly in clinics, what happens is they directly take a painkiller for temporary. They take a painkiller, they resolve the pain temporarily, and then come to the homeopath and say, "Give me some medicine so that I will not get operated, or give me some remedy that the stone should fall down." But the questions are very important. Why kidney stone happens is very interesting. I have
Thank
written a book called Third Eye of Prescription. You must be there, having that book. Ever clearly, it is written that this suppressed anger, holding on something, they don't release the anger. They don't release the anger. No, holding anger, holding on emotions, keeping grudge on someone, sala, hatred, and not expressing it openly and just keep it within. That may cause a urine stone. So you have to ask कि तेरे को किसके ऊपर है गुस्सा किसके ऊपर है on whom you are so much angry यार come on he will say how could you know this if at all right side then the questions will change because right side belongs to the boss to the partner left side belongs to your mom to yourself Salah I shouldn't have done that yaar I'm angry on myself that also may lead to kidney stone so there are so beautiful things to happen in questions are very important.
Sure, sir. I'm sure we'll learn more with you in this session. Looking forward to this session. Thank you for answering this question, sir.
Thank
See
you
you
and
all on the 9th of July.
9th of July it is.
Yes.
Okay.
HHF Mind Method.
HHF is an organization around more than 10,000 homeopaths. They have shared together, they grow together, they joke together, have friends together. So I think the day of single genius is over. We need to work together. We need to grow together. So
Very
saying
well
so,
said, sir.
thank you all and love you all. Yeah.
Thank you, sir.